Important day
Thank
tomorrow,
you.
isn't it? The introduction of the Oxford AstraZeneca vaccine, a big step in our route out of this.
Yes, it's a huge step. The thing about the AstraZeneca vaccine is that it's very simple to administer. It's like a kind of flu jab. The question is how we get an accelerated program for vaccination, which allows us to increase the production of the vaccines. My understanding is that AstraZeneca, not this week or next, but the week after, should be able to get up to 2 million vaccines a week. I think they can probably, if they know that the system can absorb more, do more than that, and you could end up with 3 million vaccines per week in February coming from AstraZeneca alone. And then you've got the Pfizer vaccine, of course, which is more complicated, but still we've got significant amounts of that. And then there's the Johnson & Johnson American vaccine, which again is a relatively simple one to administer. We booked 30 million doses of that with an option for a further 22 million. We should exercise that option. We should try and get that on stream in February as well. And what we're trying to say today is that you really need to change this radically now in order to make sure that sorry about that. We really need to change strategy radically now in order to make sure that we're getting vaccination done at a far faster rate than is presently considered.
Yeah, a few noises off there. We'll plough on. Boris Johnson said today that the hope is that tens of millions of jabs will be delivered in the next 3 months. Isn't he essentially saying what you're saying?
Yeah, but I don't think, you see, I think we're still either thinking it's 1 million vaccinations a week, 2 million maximum. What I'm really saying is we need now completely to reconsider our strategy in order to get the whole country vaccinated much, much faster. We should be, as soon as the vaccines are available, we should be getting them to people and using them. And that requires a different type of strategy because you need to use all the GP services that you've got, all the services within the health service, of course. You need to be using pharmacies, every bit of, the pharmacies that do the normal flu jab, we should be using for this vaccine as well. Occupational health workers, we should be training more volunteers. We need to mobilize resources on a scale that we've never seen before in peacetime in this country, because this new variant of the disease is much more easily transmissible. You've also got the potential for this South African strain to be a very problematic strain developing in the country. And therefore, what was good as a vaccination program a month ago is not good enough today. I know the NHS has done an amazing job. It's a Herculean effort to get as far as they have. But unfortunately, we're now in a new situation, and therefore we have to accelerate this strategy in a profound way.
Yeah,
and
but sorry, I guess the government will say that's exactly what they are doing. I mean, Britain is leading the way globally with its vaccine rollout. I've been reading your document. You're talking about maximising the quantity of vaccines and the speed they're available, using the largest number of venues where possible, recruiting and training, preparing data capture and data sharing systems. I mean, the government is doing all of this, isn't it?
No, they're not doing all of it yet by any means. I think right now there's a significant number of GP practices that aren't doing vaccinations. Pharmacies, there's a limit on the number of pharmacies we're using. I'm not sure the exact number of volunteers we've trained, but it's nothing like the amount we're talking about. And then I don't think we're using occupational health workers at all. So, no, we're not at the situation yet where we're using every single available piece of infrastructure that we could. Now, I'm not criticizing the government over this. I'm sure they're now considering it. But what we've tried to suggest in this paper are very practical ways that you can get, if necessary, and if we can, if the vaccines are available, and I think they should be, because of these new vaccines that are coming on stream, we should be doing as much vaccination as we've got vaccines available. And it's, in the end, it's a logistics challenge, it's a challenge of organization. And because these new vaccines are much simpler to administer than the Pfizer vaccine, they don't require the same storage, they don't require the same observation of patients after vaccinated, they're much easier to administer. We should be able to do this at a vastly increased scale. So I'm not criticizing the government, I'm simply setting out what could be a way that you could vaccinate the entire population in a matter of weeks.
You can only give those vaccinations to people if they're produced, and AstraZeneca have said they can do 2 million a week. But isn't it down to the production? There's only a finite number you can produce.
Sure, but the question is, can you get that up? I think what you'll find with a lot of these manufacturers is that because of these vaccines, once you produce them, they've got a half-life, as it were. In other words, you've got to use them within a certain specified amount of time. I think what you'll find if you talk in detail to the manufacturers is they'll say, we can manufacture more, provided you can tell us that your system can absorb that number of vaccines. So if you take, for example, this Johnson & Johnson vaccine, that's a single-dose vaccine, by the way, or it is at least at the moment predicated as a single-dose vaccine. They've got, my understanding is they've got very, very good capability, manufacturing capability, actually in Europe. They could probably produce as many vaccines as we needed. So that and AstraZeneca alone should give you the ability to vaccinate larger numbers of people. Their problem is they won't want to produce those vaccines unless you can show you've got a plan that if they produce them, you can use them.
Yeah, good point. Let's talk a bit about schools. Do you think schools should be going back tomorrow? We know some primaries, obviously in London and elsewhere, aren't. It's a tough one, isn't it?
It is a tough one, yeah, because on the one hand, it's a disaster for children, especially poorer children, if they can't get back into school. On the other hand, it's not so much the risk to children per se, because children aren't likely to get ill from this disease. It's very, very rare. It's the transmission. And with this new variant, it being more transmissible, it's a very, very difficult situation. So you've got to just keep it under advisement day by day, I think. But the problem is that all that this does is it puts you back into the same essential dilemma, which is absent mass vaccination, you're in lockdown. This is why I think you've got to treat this vaccination program differently now. It's literally the only way out of a severe lockdown. And as we know, every week that we lock down, we destroy businesses and jobs. There are huge health consequences of it, and of course schools and education as well. So
do you think we should have tougher restrictions? I mean, Boris Johnson's saying they may be round the corner. Do we need to bring those in now?
Look, I guess that they're looking with their chief scientists at all the data, and I'm not sitting in front of them, so it's difficult, and I wouldn't want to second guess them on it. But the basic problem they've got is that if you're a teacher or a parent, you're going to be really worried about sending your child to school, not so much because your child might be at risk, but what if they catch the disease, come back and put it into your family? And then the teachers themselves, of course, are going to be worried. Now, there may be parts of the country where the disease level is very low and it may be easier then to get the schools open. I honestly don't think there's an answer to this. It's going to be extremely difficult to keep schools open. But what it does is bring you back to the basic point. You've got to get this vaccination thing accelerated. Even though they've done an amazing job to vaccinate as many as we have now, it's got to be radically accelerated. And
finally, just briefly, it's great to have you on, of course, but do you think Labour is doing enough to challenge the government, particularly on the schools issue? I mean, Sir Keir Starmer doesn't seem to have taken a position on it yet.
Well, I think the Labour Party is pressing the government very hard, but, it's always difficult as an opposition because there's bits of information you won't have, and you're always in a bit of a bind where you don't want people to think you're just point scoring. On the other hand, you've got to keep the government to account. I mean, I actually think Keir Starmer's doing a pretty good job of that. But this is not really a political challenge in the end. It's not Labour or Tory. I mean, whichever government was in power, this is the biggest problem I've ever seen government have to grapple with. And that's why I'm always, I always start, in fact, I didn't today and I should have, I always start by saying I'm deeply sympathetic to the people in government. I've been in government. I know how hard it is. And these decisions are really difficult. And that's why when we speak, or indeed when the opposition speaks, that's why today we've given a paper with details about how you might improve the situation, rather than saying, well, why isn't the government doing a better job? It's really, this is a moment for constructive suggestion as to how we get to the end point we all want to reach far faster.